Good morning. I'm going to talk on One Health and AMR. And my presentation will include introduction, antimicrobial resistance, One Health, role of different sectors on controlling AMR. As you all know, since the discovery of penicillin, it revolutionized the management of infectious diseases and in turn on the society and the economy. However, due to the antimicrobial use or the excessive or the inappropriate use, now we are facing the emergence of resistance. Unless we reverse the current trend, we will be end up in pre-antibiotic era. So antimicrobials are used widely both in human, animal, and in the environment. And in addition, antimicrobials used for animal sector are more or less similar to what is being used in the human sector. And resistant microorganisms exist in human, animal, food, and the environment. Antimicrobial stewardships are mainly health facility based or the healthcare institutional based. However, there is large proportion of antimicrobials are used in the outpatient care in the community and for animals as well as in the agriculture sector. And issue is antimicrobial resistance does not like stay in the human, animal, or in different, not confined to any geographic location. It is a complex epidemiological issue. Spread of antimicrobial resistance, like among the pathogens and commensals, it occurs from pathogens to commensal, commensal to pathogens, and in addition from animal to food, water, human, and environment. It is different directions antimicrobial resistance, resident pathogens are transmitted. In addition, when one microorganism is resistant, these antimicrobial genetic molecules can be transferred to other microorganisms through horizontal transfer of antimicrobial resistant genes, which lead to development of resistance among other bacteria as well. Because of these things, it is necessary to have a broader One Health approach to control antimicrobial resistance. What is One Health approach? So it is a collaborative, multisectoral, and transdisciplinary approach, and it is not only at local or regional level, it should include at national as well as global levels. And the goal of One Health approach is to achieve optimal health outcomes, recognizing the interconnection between people, animal, plants, and their shared environment. This One Health approach is not only for antimicrobial resistance, it will support the control of zoonotic diseases as well. So COVID-19 highlighted the importance of looking at the emergence of zoonotic diseases, including the infections caused by drug-resistant pathogens. So the burden of foodborne diseases is substantial, and 1 in 10 people fall sick due to foodborne diseases, and about 420 deaths, with 1/3 of the deaths are among the children. Main drivers of antimicrobial resistance, as we mentioned, it means misuse and overuse of antimicrobials. In addition, lack of access to clean water, sanitation, and hygiene, which lead to infectious diseases, will cause use of antimicrobials. And poor infection and disease prevention, which lead to increased infectious diseases and increased use of antimicrobials, as well as transmission of resistant pathogens. Poor access to quality affordable medicines and vaccine. So when there are no quality drugs, so it is not effective, but it may cause these chemicals will lead to antimicrobial resistant development, and the disease get transmitted. And vaccines, non-availability of vaccines lead to contribute to the it reduces the chance of controlling infectious diseases. Lack of awareness and knowledge, which not only among the public, even the healthcare workers, lead to misuse of antibiotics or antimicrobials, as well as different messages will go to the public on antibiotics. Then lack of enforcement of legislation. There are various legislation to control infectious diseases, foodborne diseases, and even control of use of antibiotics. Unless these regulations are in enforcement, there will be so it will contribute to the antimicrobial resistance. Like in this picture, antimicrobials used in human, animal, and agriculture sector will lead to development of antimicrobial resistance. Now, antimicrobial resistant pathogens develop in the agriculture and animal sector lead to these resistant bacteria will come into the food either due to the contamination at the slaughter and carcass dressing level at the meat products, or other agriculture product might get contaminated from environment, water, and from manure. In addition, during the post-harvest stage, due to the food handling or food handler, improper food processing, and unhygienic food processing environment will contribute for the contamination of food. This is one of the study done in Netherlands, where they have analyzed the 20 years data where AMR positive isolates, about 8,799 isolates are included, and it revealed these pie charts indicate now different pathogens in E. coli, Enterobacteriaceae, Campylobacter, Salmonella, different Salmonella serotypes, and different gram-positive isolates. The green indicate the meat and meat products, blue indicate the fish. So we can see majority of antimicrobial resistant pathogens are coming from meat products. And in this picture, this brown indicate the poultry. So majority of resistant bacteria coming from poultry. And in Sri Lanka, when we talk about non-typhoidal salmonella, which is of zoonotic origin, main serotype is the Salmonella enteritidis, and second is the Salmonella typhimurium. And antimicrobial sensitivity pattern of non-typhoidal salmonella in 2020, we can see this red and purple are from for the resistant, and red is from human and purple is from food. So ciprofloxacin resistant and ampicillin fluoroquinolone resistant, because cipro and nalidixic acid shows the resistant, and the ampicillin resistance are the significant problem. We have analyzed the Salmonella kenchuki antimicrobial resistant pattern, where we can see it is different from other non-typhoidal salmonella. Here it is more than 90% of isolates, even whether it is coming from food or human, resistant to ampicillin and ciprofloxacin. And it shows the gentamicin resistant also quite high, about 88% from human. However, food isolates from food are only 36%. Salmonella enteritidis ciprofloxacin sensitivity is going down. Now it is just less than even 40%. This is Staph aureus from meat, pork, and there were 5% of isolates, so MRSA, methicillin resistance Staph aureus, and cipro resistance was 15%, and tetracycline resistant was 30%. And in this, after gene sequencing, Salmonella enterica chest was having about 5 AMR determinants belonging to 5 different antibiotics, and the Salmonella enterica kenchuki from poultry was having 6 different classes of antimicrobial resistant determinants. However, the resistant only 17.5% of human isolates and 87.9% of poultry isolates were having at least one resistant genes. Campylobacter erythromycin sensitivity was 22% in Sri Lanka, which was 3.4% in UK. And for the macrolides in US, it was 28%. However, Cipro-resistant was 83% in Sri Lanka, Campylobacter in Sri Lanka. The CDC, it was, according to CDC data, it was 27%. So how do we control antimicrobial resistance among the different sectors? So we need to stop development of antimicrobial resistance in bacteria, and we need to stop transmission of antimicrobial resistance among bacteria. So we have the National Strategic Plan, and other countries are also having different National Action Plan. So we need to have a integrated surveillance. Now, as we have discussed, integrated surveillance will generate data about antimicrobial resistance as well as antimicrobial use in different sectors. Based on this data, it is important to carry out the risk assessment to find out the critical control points, and we must address particularly those points where we have to control use of antimicrobials and prevent development of antimicrobial resistance. Meantime, we have to stop transmission of antimicrobial resistant bacteria. So for this purpose, we have different regulations, guidelines, and standards, but some are regulations. We have regulations under Food Act. So we don't have under Food Act, we don't have particular regulations for antimicrobial resistance, but we have food hygienic regulations which will support the transmission, prevent transmission of foodborne pathogen. And we have in new regulations which are coming up now. At the moment, we have for the meat regulation, we have included minimum residual limits for antimicrobials, and so we need to prepare a minimal residual limits of antimicrobials for food. Then regulations under Animal Act, there are under the Animal Disease Act, veterinary drug control authorities in place which control the import, export, manufacture, repacking, sales, and use of veterinary drugs. And veterinary sector has already banned antibiotic use as growth promoters in Sri Lanka since 2017. So those will contribute to reduction of development of antimicrobial resistance. Then there are standards like SLSI standard, which again mainly addressing the food hygiene, and the Codex standards. These are international standard for food safety. Codex standards, there are three standards mainly addressing antimicrobial resistance, like antimicrobial resistant risk assessment, antimicrobial containment, and minimum residual limits for antimicrobials in food. So in addition, industry and the agriculture sector they are already adhering, some of the industries are adhering to good manufacturing practices, good agriculture practices, HACCP, even antibiotic-free certification. So these systems will support to control antimicrobials in the food as well as antimicrobial resistant development. So the data, we have challenges like, as I said, lack of data, and then when antimicrobial resistance, due to antimicrobial resistance, there are challenges for health, where we don't have antimicrobials, or the antimicrobials available are costly or having more side effects. So increased mortality, morbidity. Then when it comes to antimicrobial resistant control regulations, we will have a problem of if we, due to the antimicrobial resistant pathogens, if we prevent food coming into the market, there will be, if it's allowed, there will be a food safety issue. Then if it is not allowed, then there will be a food security issue. So there are trade and economic impact will be there. So in addition, the regulation and standards, inadequate regulation and standards, as well as enforcement has to be strengthened. So data, we need to have quality data to act on. So it's very important to have a good sampling for to get this representative data. Then accredited laboratories should generate data, and we must use newer techniques to get the gene sequencing or metagenomics in generating data with the epidemiological value. In addition, antimicrobial usage data, and based on these data only, we should act on. So this is one of the example. This is one of the example. In UK, the One Health approach has been successful, and over 2014 to 15, the E. coli, the fully susceptible E. coli was increased by 30% when it was evaluated in 2016 to 17. Likewise, proportion of indicated E. coli isolates with decreased susceptibility to at least 3 antibiotics from different classes from predefined panel of antibiotics decreased by 20% from 57 by 20%. Likewise, ciprofloxacin resistance of E. coli has decreased by 7%, and E. coli with ESBL MC producing indicator E. coli was decreased by 5%. This is one of the success stories from UK. So it's like, so it's very important, like in controlling antimicrobial resistance, One Health approach is, because it's a multi-sectoral environment, One Health approach is very important. And there should be sustained political will to carry out these activities. We must use diagnostics to diagnose infectious diseases, and by that we can use targeted therapy. We can curtail use of antimicrobials. Then infection prevention, biosecurity measures, and control practices should be in place at all the sectors across human and animal, and antimicrobial stewardships. Then the food safety and food hygienic practices will play a major role in controlling foodborne diseases as well as foodborne AMR. Then vaccination both in human and animal sector. Then the waste disposal is very important, because it is to control antimicrobials in the environment. There should be we must prevent antimicrobial residue going into the environment. So waste management at hospital level to prevent antimicrobial residue going into the environment, as well as antimicrobial residue from antibiotic manufacturing plant should be in place. In addition, it's important to improve the knowledge of healthcare workers and workers from other sectors, as well as from the public. So it will improve the it will support the support to control the antimicrobial resistance. Thank you.